Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be talking about a pain medication known as Tramacet, which is actually just two medications combined into one, that being Tramadol and Acetaminophen or Tylenol. So this medication is classified as a central acting analgesic. It's not technically an opioid, however in a pharmacy and hospital we do treat it as an opioid in terms of keeping track of inventory and recording any movement of the medication. So in terms of use, we already said that it's used for pain, but it's typically reserved for people who have moderate to moderately severe pain. In this setting, we don't have much data for use beyond 12 weeks, so any physician who prescribes it for a long duration of time should just do some close monitoring after the 12-week period. It is not indicated for mild pain that can be treated with other less intense pain medications. Before somebody was to use this medication, there are some contraindications that they should be made aware of. So Tramacet should not be administered to anybody who shows a previous hypersensitivity to Tramadol, Acetaminophen, or some other select opioids. Tramacet is also contraindicated in any situation where typical opioids would be contraindicated. This includes acute intoxication with the following substances: alcohol, hypnotics, narcotics, opioids, antipsychotic medications, or other centrally acting analgesics. And finally, Tramacet is contraindicated in people who have used a monoamine oxidase inhibitor within the last 14 days. Aside from contraindications, there are also some warnings or precautions that people should be made aware of before taking this medication. It has been indicated that when Tramadol is taken above the recommended dosing range, it can increase your risk of seizures. It can also increase your risk of seizure if you're taking this medication with some of these following medications: SSRIs or selective serotonin reuptake inhibitors, bicyclic antidepressants, opioids, monoamine oxidase inhibitors, neuroleptics, and most other drugs that decrease the seizure threshold. Although it's rare, there is a risk of an anaphylactic or allergic reaction after taking Tramadol. This would typically present as itchiness, hives, potentially some edema, bronchospasm, and even Stevens-Johnson syndrome. With Tramadol, there is a risk of forming dependence to the medication, similar to what you would see with morphine. It's also recommended to avoid using this medication with alcohol. If somebody was using the medication for an extended amount of time and they came off the medication, there is a chance they could experience some withdrawal symptoms. This would typically present as sleeplessness, sweating, insomnia, rigors or pain, and sometimes nausea, diarrhea, and even tremors. Now, in terms of patients with liver or kidney disease, in terms of liver disease, it should be avoided in patients who have severe liver impairment. If an individual has a creatinine clearance of less than 30 mL per min, so talking about your kidneys, the dosing period should not exceed 2 tablets every 12 hours. Now keep in mind with this medication, it does contain 37.5 milligrams of Tramadol, as well as 325 milligrams of acetaminophen. So while you're using this medication, it's important to note the amount of Tylenol you're using on a daily basis, if you're using any extra Tylenol, of course. So once somebody is made aware of all the contraindications and precautions and they go to use the medication, the dosing would typically be 1 to 2 tablets every 4 to 6 hours. The maximum dose would be 8 tablets in one day. If you're just starting the medication, it's not uncommon that you would start off on a lower dose than what we just discussed and work your way up to the daily recommended dose. Your increase in dose would stop once you have the pain relief you desire. It hasn't been studied in young populations, so typically these dosing regimens would be reserved for people over the age of 19. When somebody's using this medication, there are some side effects or adverse reactions that they may experience. Up to 7% of individuals may experience fatigue, 2% may experience flushing, and 3% can experience some influenza-like symptoms. Headache and dizziness are relatively common, coming in at 15 and 11%. Nausea and constipation happen about 18% of the time. Some people experience dry mouth, vomiting, or abdominal pain, and 14% of people experience somnolence. Interestingly, a small amount of people experience itching with this medication. That's all we have to talk about today with Tramacet or Tramadol. As always, keep in mind that this channel is to be used for information purposes only and not to be used as a source of recommendations for your personal health care. If you'd like to help see the channel grow, you can subscribe to the channel, share the videos, or leave a like on the video as well. Take care.